just really important that when we have a clearly viable problem, right, and we can diagnose based on this problem. Okay, you're having symptoms based on long, like we have been self-diagnosing long COVID for like 4 years. It's okay. It's an accepted idea. You have long COVID. So first things first, we need to make sure you don't have any persistent virus. And as we do not have the diagnostics to ensure that you do or don't, we should do the treatment that we would do for an acute patient, exactly the same, and see if we see clinical benefit. We should just do that. That's a simple case to make. There are no extra steps. There's nothing between the patient and the treatment.
Well, and the other thing about that is from an economic standpoint, the thing that is the determinant there of whether there's improvement is the clinical response, and that makes it more accessible to patients that may not necessarily have the means to access more advanced analytical methods, right? Like, and
Right.
there's definitely a place for advanced analytical methods,
A
but
hundred percent.
I think the challenge is how do you have the most accessible treatment regimen possible and the most accessible clinical diagnostic framework along with that.
Here's my thing too. I want to spend the next 10 years focusing, not even 10 years, 5 years, focusing on eradicating COVID, not trying to learn to live with it. That's my other thing. Like there's this
Exactly.
attitude going on that people don't realize they're adapting to this learn to live with it crap. Like we need to exterminate it before it exterminates us. And the whole thing people keep saying is, well, we don't have the time. We don't have the time. And you're like, exactly. We don't have the time.